All Things Conceivable, a surrogacy podcast with Nazca Fontes.
Listeners, welcome to another episode of All Things Conceivable, a surrogacy podcast. This week is National Infertility Awareness Week, and we're hoping that we can help shed some light and awareness on something that affects 1 in 8 couples across the country. Many of our families who come to us have experienced long and challenging fertility journeys before they ever meet their baby. And for those of you who are experiencing infertility, know we're with you. We're so thankful to be able to bring hope and help to people so that they may fulfill their dream of building their families. Today we have esteemed New York Reproductive Endocrinologist and fertility expert, Dr. Joshua Stewart. Dr. Stewart, welcome to the program.
Thank you so much for having me. I'm so excited to be here.
Likewise. We've got a lot to cover this week, so why don't I dive in, and why don't you just help get our listeners acquainted by telling us a little bit more about you and your practice?
Of course. Well, thank you. Like I said, thank you so much for having me. Very excited to be here. I'm a reproductive endocrinologist and fertility specialist in New York City. So I have general background training in obstetrics and gynecology, but primarily focus on fertility medicine, and I see the broad range of fertility patients. So all the way from infertility to a large portion of my patients are patients that are trying to conceive with donor egg, donor sperm, and gestational carriers, and everything in between.
Well, you know, you are very interesting to me and to the listeners once they hear a little bit more about your story. And of course, one of National Infertility Awareness Week's messages is that we can all be part of the conversation. And so for you in particular, you actually went through your own journey to have a family that was a little bit less than conventional. It involved the collaboration with a gestational carrier, or a surrogate, as we know her to be called. So would you like to share a little bit more about your experience with surrogacy?
I would love to. Thank you very much. I think, certainly there's always, it's a unique experience to have both personal and professional experience with different treatment options and courses of treatment. So I would love to share a little bit about my own pathway. So my husband and I started trying to build our family about 4 years ago. And one thing that sort of my patients, I always tell my patients, is that I'm an optimist, so I'm always glass half full. So hopefully that will come through in what I'm saying today. But I think it's important, I was thinking about this in anticipation of speaking today. It's important to sort of note that often, the stories that we tell are that everything has worked out perfectly and we're at the end of the road. And, I have to share today that we still don't have a baby, which is has been difficult, but I want to try to use that as encouragement to people to keep going, and that there is light at the end of the tunnel, and it is worthwhile to keep going and to be persistent. So as I said, we started about 4 years ago, and when we came into this, we still joke about it today, is that, we came into this as two guys, and so there were, certain things that we, either anatomy or eggs, that we couldn't bring to the table, and so we thought it was going to be a little bit about just logistics and sort of bringing those pieces together, and it would be smooth sailing. And on top of that, I'm a reproductive endocrinologist and fertility specialist, and so we thought that it would just be smooth sailing ahead. And I wish I could tell you that it wasn't, but it really was sort of one obstacle after the next, and it was some of them were medical issues, and some of them were totally unforeseen, and some of them were, logistical issues. One of them was a combination of both, which was that a lot of this overlapped with the COVID pandemic, which is something that has affected a lot of our patients. And so that's sort of the brief overview. To tell you a little bit more, we had matched with a gestational carrier that we really just meshed with so well. And we felt so comfortable with her and her family. And I think one of the big things that I'd like to convey that I think is so important about the gestational care process is really the fit between the intended parent or parents and the gestational carrier, because it's all about trust. We go through a rigorous process of medically screening gestational carriers and the eggs and the sperm and the embryos to make sure that everything is safe for the gestational carrier and the intended parents and the hopefully eventual happy, healthy baby, there's also this really important part of finding a great fit, because that helps build a relationship of trust between everybody that's involved. And we found that, and we were so excited and so happy, and unfortunately moved forward with an embryo transfer of a genetically tested normal embryo that didn't work, and then subsequently had some difficulties getting back to being able to do another embryo transfer. And that obviously was very disappointing. And on top of that was really painful when we made the decision to switch to using a different gestational carrier, as we had really built a relationship with this person. We felt very comfortable with her. It was also very disappointing to her because she obviously wanted to help us build our family. But we made the decision together to move to a different carrier, and had real difficulties in sort of getting back to that fit again, and being able to find somebody that met all the medical criteria, as well as sort of just finding the right fit with someone. I'm pleased and very happy to report that we've gotten back there again, and concurrently, a lot of the things changed. As I mentioned, I live in New York City, and so a lot of the things with the New York State Family Building Act law changed, and so we were able to find a carrier that lives in the New York area, which was very convenient for us because we really want to be involved with the process and be able to support the gestational carrier throughout the process, partially by being there in person for some of the visits and things. So I think that kind of the takeaways on this was that it's okay if it doesn't work out quite as smoothly as you think it will be. And I want to also encourage people that sometimes it does work out really, really smoothly. I have friends and patients that have gone through the process, and it really is smooth sailing. It's sort of, we create a to-do list, you check it off, and it's all, it's full steam ahead. So that is possible. But if it doesn't, it's okay. And it will work out, and it's important to stay persistent. And it's really important to have a very important team of support behind you, both medical professionals and the agency for the gestational carrier, as well as your personal support system as well.
Wow, you just hit on so many important topics, and if I could just unpack them a little bit one by one. But I think, at the top of the list is that you now have such a unique perspective, not only from, your medical point of view and the advantage as a medical professional involved in assisted reproductive technology. So you get that part. But what is often missed, I think, by many clinicians is a much deeper understanding of what happens after a match, what happens after embryo transfer, and all of the intricacies and complexities associated with surrogacy. And so I might maybe speak for you by saying, I think now you could look at this through a much more empathetic lens when it comes to your patients who need to pursue a surrogacy journey. Again, there's so many complexities above and beyond the medical components surrounding surrogacy. So I love that you have a unique perspective, and I also love that you've been able to articulate so clearly for our listeners that it's not necessarily a linear path, that it can be circuitous and there can be setbacks, but that perseverance and persistence are key, right? They really are. And, when we think about this week being Resolve's Infertility Awareness Week, one of the week's missions is to unite the millions of Americans who want to remove the stigmas and the barriers and perhaps some of those complexities that stand in the way. So, you said it in your own personal story, but if you were to speak to the audience in particular about infertility and its effects on individuals and couples, what would you say to them about, kind of, again, that perseverance, and what do you want them to know in terms of how they can keep going?
Absolutely. So to echo what you said before, I think that it has certainly given me new perspective as a clinician. And I think that one of those things sort of goes to your question, which is that it's made me much more sensitive to timelines. Mm-hmm. I remember, I'll never forget getting the first call after that embryo transfer did not work. And I knew all of the statistics from being a doctor. I knew what pregnancy rates should be, and with a genetically tested normal embryo and a gestational carrier. And so obviously there was some disappointment there. But I think as the sort of dust settled, what really became apparent that became very painful also was the timeline. My husband and I, like so many couples that are using third-party reproduction with donor egg, donor sperm, or gestational carriers, realize that it's going to be a process. And so you realize that there's a certain timeline. And when we first started, we thought we were sort of being ahead of the game and getting things started, before we were really ready to even have a baby. And I think that was one thing that really caught me off guard and catches a lot of patients off guard is the timeline. And so that's the first thing, is that I would encourage, people, individuals or couples that are utilizing third-party reproduction for their family building to really maybe start and getting some information before you think you really might actually be ready, because at least ready to have a baby, because it never hurts to get more information. And there are some building blocks that you can put in place that really set yourself up to be prepared for those timelines. And similarly, as you probably know with so much experience in the field of gestational care, is that sometimes patients that get to the stage of using a gestational carrier have been at this already for a very long time. And so they're already very aware of how 1 month can turn into 2 to 3 to 6. And so I think the first thing is the timeline. And I think the nice thing about that is that there's an action point. If I could sort of encourage anybody that's listening to this at home that is, sort of just starting out about sort of debating whether or not to make that appointment with a fertility specialist and, to get testing and find out more information. I understand there's a lot of anxiety that revolves around that, because you can't be scared of what you don't know necessarily. And so sort of there's this anticipation of finding out bad news or things like that. But I would encourage people that it's the exact opposite, that it may sound cheesy, but the information really can empower you. And, seeking out, where you stand with your fertility status, getting a basic evaluation with a fertility specialist and sort of mapping out a course can be really a very, very critical first step, and can set up that timeline so that you're not also, fighting against that as well.
So, we presume, I think, being in this field and living it day to day, but I guess we presume that everybody knows how infertility is defined. And so your message to those who are just listening at home and thinking about starting the process, they're a little bit confused, they're a little bit scared, they don't know really where to begin. Why don't we actually just start by telling our listeners what the clinical definition of infertility is and the current numbers associated with it, so that they don't feel so alone?
Yeah, absolutely. Well, I think the important thing to do is that to sort of look at that the fertility landscape is really evolving, and it's evolving because families are evolving, and what a family looks like is evolving. And so sort of I always caution patients that, there's a couple of seats that sit across from my desk, and there's lots of different individuals and couples that fill those seats. And it doesn't look like probably what it looked like 15 or 20 years ago. And it probably looks very different in New York City than it looks at other parts of the country as well. But, infertility was traditionally defined in heterosexual couples based on the age of the female partner and the length of time that you've been trying to conceive. So if you were less than 35, if you had been trying for 12 months, or if you're older than 35, trying for 6 months, then that sort of was the sort of basic traditional definition of infertility. Now, as you might imagine, that definition is not applicable to a large proportion of patients that sit in my office and that seek fertility care. And similarly, even for certain couples, those definitions may not be applicable because, for instance, if a woman doesn't have regular menstrual cycles, then it really may not be appropriate to wait 6 to 12 months to see before seeing a fertility specialist. Or if you've had particular procedures where, let's say, one or both of the fallopian tubes or ovaries have been removed, then it might be advisable to see someone sooner and be evaluated sooner. And then obviously, couples or individuals that are trying to build their family through using donor egg, donor sperm, or gestational cares may not meet traditionally defined infertility criteria, but still may seek the services of a reproductive endocrinologist or fertility specialist like myself.
Yeah, that's very interesting. Even asking the question now, after, nearly 30 years of work in this field, that used to just be kind of part and parcel, part of the conversation. It was quote unquote infertility. And now it really has migrated to fertility treatment, because I love that analogy that you just mentioned about, the two chairs across from your desk, and so many different individuals sit in those chairs and have these very deep conversations with you about how they're going to build their family. And it has changed so much in the last couple of decades. It really is remarkable. So I happen to agree. It's no longer infertility. I think it's just simply fertility treatment and fertility awareness, because we all come in different shapes and sizes and have different approaches to how we're going to build our family. So I also want to ask you a little bit, we might be getting a little bit technical, but I can guarantee you there's going to be some of our listeners who really gravitate towards this. You've done a lot of research on male factor infertility, is that right?
That is correct.
And if so, how about if you share, in a high-level summary, some of your findings?
Sure. So I think that's one thing too. We talk about misconceptions around fertility and the fertility evaluation. I think that in certain couples, there's this misconception that it's really just the female partner that needs to undergo testing. And the truth is that major abnormalities on the male side, on the sperm side, are rare, but mild abnormalities are very common. And a lot of times there are really effective, not necessarily super invasive things that we can do to try to help optimize those mild abnormalities to really help improve pregnancy rates. And so a lot of my research has centered around trying to find different ways of quantifying and qualifying the sperm. So usually the basic evaluation on the male side starts out with a semen analysis. And so that semen analysis gives us some basic information about the sperm. And so the basic parameters are their concentration, the motility, which is the percentage of the sperm that are swimming, and the morphology, which is the shape of the sperm. And that gives us some information. And for a very long time, historically, we've thought that was sort of all the information that we really needed about assessing the sperm. And now we're really finding out a lot of really exciting diagnostic possibilities that can further advance our understanding of sperm quality and how that may tailor specific treatments to certain individuals or couples, and help us understand what's going on at a basic biological level. So some of the research that I did during my fellowship centered around some very technical basic science things, looking at what are called exosomes, which are these little packages of information that are transmitted in our bodies that transmit DNA and RNA and proteins, and basically chemical signals to help communicate amongst the different cells in our body. And so we were looking at seeing if those communication pathways were different in guys that had normal semen analysis parameters versus guys that had something called azoospermia, which is where there's no sperm in the ejaculate. And so we were looking at some of the different packaging of those things. We're hoping that eventually research like this will lead to additional advanced diagnostic testing for guys with male factor infertility. And one of those that we're using clinically right now is looking at something called DNA fragmentation. And so it's specialized testing on the sperm to see if an increased amount of the sperm carry fragmented DNA, which may decrease fertilization rates, pregnancy rates, or increase the amount of abnormal embryos that are created through artificial reproductive technologies or through conceiving.
So you've hit upon a lot of advances in male factor and a little bit on other fertility treatments. Outside of the male factor realm, what else are you seeing that's exciting coming down the line in terms of advancements in the field?
Oh man, we could do a whole separate podcast on that, right?
Yeah, maybe I'm opening Pandora's box here.
No, you're great. I think, to sort of condense a couple of things that I'm very excited about. So one is genetic testing, and that's a broad seriously, obviously we could have a separate podcast on genetic testing, but
Of course.
one
Right.
thing is genetic carrier screening. So these are panels. It's a blood test for the patients that basically helps us screen for genetic predisposition to certain things like cystic fibrosis, Tay-Sachs, thalassemia, sickle cell anemia. And the way that those work is that you need to have 2 abnormal copies of a gene in order to actually have the disease. So you need an abnormal copy from the egg and an abnormal copy from the sperm. And so those panels are changing all the time as our understanding of the genes that are involved change. So just for instance, in that panel that we were using about a year ago, there were 282 conditions that we could screen for, and now that's gone to 511 diseases that we can screen for. So that's one thing. The other thing with genetic testing is that we are able to do genetic testing of embryos, which is abbreviated PGT, which is pre-implantation genetic testing. And we can do that for the number of chromosomes, which is related to the age of the egg that was used to create the embryos. And we can also do it for certain mutations. So we're seeing a lot of patients that find out more about their family history and their genetic history. And so for certain cancer syndromes like BRCA or Lynch syndrome, patients are choosing to do that type of testing on the embryos to ensure that the pregnancy does not carry that same mutation. So I think these are really exciting technologies. They needed to be interpreted in the right context. We won't get off on topic today, but there's lots of things in sort of mainstream news about the efficacy of these different testing modalities. And so obviously they need to be conducted in the context of very good counseling with a genetic counselor or a certified physician, but in the right context can be really, really powerful for helping patients build healthier families.
A terrific summary, truly, of the scientific advancements, available for folks who need to pursue treatment in a clinical setting. So pivoting just a little bit from the technological and scientific advancements to some of the cultural advancements that we've made in this field. And I think with the advent of same-sex marriage in particular, and the normalization of gay men having children via surrogacy, it's made a great impact on increasing the awareness and the use of surrogacy in general. So what was once fringe or unspoken truly is now on the table for everyone, and the way it should be. And I do understand that a current area of interest for you is the LGBTQ reproductive service aspect of this. So do you want to expand a little bit and tell me more about that and let our listeners hear how you're involved?
Absolutely, and thank you for the opportunity to speak about this. I think that it really starts with awareness, and from my perspective, it starts on sort of patient education, sort of understanding what your reproductive options are, and having access to those things. So understanding, what the route forward of conceiving with donor sperm and intrauterine insemination is, and what's involved with matching with an egg donor, and having resources or access to gestational carrier agencies that are able to provide the right fit for intended parents and gestational carriers. So the awareness of the resources that are available, and seeking information from certified medical professionals to help guide that process. I think that we've really seen just a much broader acceptance of utilizing these services and the different ways that a family can develop. And I think that that's been really, really powerful. There are things that people have spent a lot of time and effort for advocating for. And I can speak to that sort of in New York State, where I live, which is that the gestational carrier law changed last year. So previously, you could not have a compensated carrier in New York State. And that changed recently, and that has made a profound impact on so many people's family building outlook. I'm a perfect example of that. There was a time where, there really weren't a whole lot of options to have gestational carriers in this local area, and so many of my, very, very close friends went to, their gestational carrier lived in California, and they were sort of scrambling right before delivery to try to, rearrange work schedules and book flights and try to make it in time to be there for the delivery of their child. And, there's enough stress in life and in this process. And so I think with, the landscape of fertility and family building is really changing and evolving. And all of our, I think, perspectives as a society and as a community are also moving forward and really spreading the access to these services.
Agreed. I would say that, there's been this momentum towards normalizing not only, third-party reproduction, but surrogacy in particular. I started out just doing egg donation here at ConceiveAbilities, eventually, moving into the world of surrogacy, and just the arc the arc of progression of acceptance in my 26 years of doing this, specifically ART. So it really is remarkable to see the changes taking place. And, they're all shored up by good practices, legal protections, and a lot of ancillary professionals really coming into their own in terms of their own understanding how best support these families moving through a surrogacy journey. So a lot of advancements have been taking place, no doubt. So ConceiveAbilities this year is celebrating a quarter century of building families. And, we just could not be prouder and more excited about bringing our own experience to bear into the future. And so as I was reflecting on lessons that I've learned over the course of time that I bring, I hope, with me every day in supporting our families, one of them truly is that modern family building is evolving and surrogacy is leading the way. Naturally, I look at this through a little bit of a biased lens, right? I do believe that surrogacy is leading the way. So how specifically would you see third-party reproduction evolving, and how will surrogacy continue to grow, especially for people facing fertility challenges?
Absolutely. Well, congrats on 25 years, and that's really incredible, and hats off to the amazing work that you guys do. I think that we will continue to see the utilization of gestational carriers for family building increase. I think that it's not just acceptance on sort of a larger scale across society and communities, but it's also acceptance and awareness on an individual level. And I think we could look at that from both the perspective of the gestational carrier and the intended parents. So on the side of the gestational carriers, I think that, if there are a lot of people that I think have a lot of interest in doing this wonderful, amazing thing of helping an individual or families that otherwise would not be able to build their family through gestational carrier, being a gestational carrier. And I think that the more information and awareness that is out there for people that would be interested in being gestational carriers, and helping to reassure them that this is can be a very safe process, that it is highly regulated, and that we have very stringent requirements for screening the eggs and sperm that become embryos that will be transferred to the gestational carrier, and that it can be extremely effective and success rates are very, very high. I think that the more information that we put out there as a community really spreads the acceptance amongst potential gestational carriers, that this would be something that they would be interested in doing, and that it can be a safe, very effective process. And on the side of the intended parents, I think that more and more patients are sitting in my office and they have heard about gestational surrogacy through a friend or a relative or a coworker. That is not something that I think probably would be as common as it was, 5 or 10 years ago. You could probably comment on this, but I think that more and more people have either read a news story or have had somebody on a local level that has undergone the process. And I think that on a individual level helps normalize it for them too, that they can get through this, that it can be safe and successful. And I think that provides a lot of reassurance and confidence to a lot of our intended parents and the gestational carriers as well.
Yeah, I think that the gestational carriers are, they're remarkable women, no doubt. And, to hear time and again from respected clinicians in the field that this, is a very safe process. They've already given birth themselves and have had uncomplicated pregnancies and obstetrical histories that allow them to continue with the prospect of becoming pregnant again with the intended parents' embryos. I think it's important to note, too, that they do have a network of safety and security around them with all of the professionals involved, from the doctors to the attorneys to, the mental health professionals, and then, the more administrative parts of the process that are equally as important, the escrow management and, proper insurance coverage and what have you. But one thing that we did notice over the course of time, and we were thinking about how could we continue to improve the process on behalf of our gestational carriers. Part of our value as a company, one of our core values, is this value of refinement. We're always seeking to improve and create, more value for the participants in a journey. And one of the things that we recently did is we rolled out what's called a 4th trimester care plan. And it was designed so that the gestational carriers who go through this, who give so much of themselves, and at the end there's, this joyous, overwhelmingly, statistically, overwhelmingly joyous moment where they give birth and the intended parents are have that new family. Well, as soon as the balloons are popped and, everybody goes home, we really wanted to provide more care for the healing and recovery on behalf of a gestational carrier. So this 4th trimester really puts an emphasis on her physical and emotional recovery. So everything from continuing with mental health support to having access to pelvic floor physical therapy or recovery with a doula service or nutrition, physical activity. So knowing that this is now in place, at least with a company like ConceiveAbilities, do you have a medical perspective on that service offering to gestational carriers?
Absolutely. I think it's extremely important. I think that we talk about, I always say to my patients that the fertility process requires we have these buckets of resources as humans, and it requires all of our resources: financial, emotional, physical, time. And I think that we have to consider all of those pieces, with the gestational carrier process. And, it doesn't end with delivery of a healthy newborn. There is I think about this all the time, is that, hopefully when we bring home our happy, healthy baby, I won't be physically recovering from a pregnancy and a delivery. And that's a really huge aspect of this process for so many people. And it will be a part of the process for the gestational carrier. And it's important for her to feel supported, both physically, medically, and emotionally in that time period. I work in my practice. I work with intended parents, and I also work with gestational carriers. And I'm part of screening gestational carriers and caring for them during their pregnancies as well. And they're my primary patient. And on the flip side, I also see the intended parents also not together, but in different arrangements. And I think that it's really important to see it from both perspectives. I think that one of the things that I've seen be really successful is that in situations where the intended parents and the gestational carrier really communicate about what they anticipate post-delivery to sort of look like. And I think having clear expectations of sort of how much communication both parties want can be really, really helpful. I know that, some gestational carriers, there certainly is this I don't know if it's if you articulate it sadness, but there's certainly this departure that there was this very close relationship between the gestational care and the intended parents, and then after delivery, it seems like on one hand the process is over, but then there's still this physical and emotional healing process that is taking place. And so I think one of the things that can be really effective is just having really open lines of communication early on in the process of what everybody anticipates that process looking like, feeling like, and sort of what's the best way for everybody for that to play out.
Indeed. Well, you certainly know a lot about surrogacy, and of course, bringing your skills to bear and your level of expertise in the medical field to treat all kinds of patients, inclusive of gestational carriers, is really remarkable and unique, and in high demand and greatly needed, and certainly appreciated, Dr. Stewart. So as we look to kind of wrap up our time together today, you've shared a lot. If you could share for our listeners in particular some of the most important lessons that you've learned in caring for them, what would be your aha moment in terms of, you found something that's truly important and valuable to the patient? What would it be?
Sure. I think the thing that I've learned that I think that I try to share with my patients is to be patient with yourself. There are, certainly when you are undergoing fertility treatments, when you're conceiving with donor egg, donor sperm, or using a gestational carrier. If we start with just the gestational carrier process, there are a lot of couples or individuals that never anticipated needing to use a third person for building their family. And on surface level, that may seem disappointing. And even, I can speak from personal experience, even, in same-sex couples where you sort of always knew that there had to be a third person involved with the process, it may still, when you think back to like when you were a child, it may not have even sort of been on your radar screen of sort of how you thought your family building process would play out. And so I think to be patient with yourself, by that I mean there are going to be certain days where it seems really easy and you're okay with it. And you're like, this is what I want to do, and it seems easy to sort of stay on course. And then there are going to be other days where you wake up and you really, really want to have a baby, and you really, really want to build a family, and you're okay with it all, but it just doesn't feel like you have the same amount of energy to get up and do it all. I was recently sharing with one of my patients that for some reason, I remembered, and anybody who's gone through this process can echo this, there's a lot of forms that have to be filled out, and a lot of them have to be notarized. And I just remember I got to a process where we were sort of like, had some disappointment along the way, and I just like didn't feel, there was one day where I just like didn't feel like I had the energy to like print another set of forms and take them and get them signed and notarized. Yeah. And in the context of this whole process, it's like really pretty minuscule in the amount of resources that requires. But I thought, you know what? I have to give myself a week. I just don't want to fill out any more forms. I don't want to have anything else signed. I just need a break. And that's okay. Be patient with yourself, because you will come back around and you'll wake up again and you'll feel very motivated and you will get back to that place again. But be patient with yourself, because there's going to be good days and there's going to be bad days. And in the end, it will work out.
What sage advice, and I couldn't agree more. Absolutely the most important topic for patients who have to get back on that horse. Be patient with yourself and persevere. So what a wonderful way to end the podcast and our interview and our conversation today. Dr. Stewart, upon reflection of your own practice, is there anything that you felt that we haven't covered today that you would really want our listeners to hear from you?
I don't think so. I think we've really covered a lot of ground today, and we've really had a lot of opportunity to touch upon a lot of really important things that are going on in the field. I would just echo what we said before, which is that it's really important to have a good team behind you and to sort of pick the team that makes you feel comfortable and confident. And that's, really multidisciplinary, medical professionals, mental health professionals, like you said, legal, financial, gestational care agency. Really important to pick a great team.
So every time I have a physician on my show, I just leave the conversation thinking they're so bright, so insightful, so compassionate, so empathetic, so skilled at building families. And Dr. Stewart was certainly no different. And when I really reflect on the conversation and trying to summarize my aha moment, because I always have an aha moment from these conversations, what struck me most about the conversation was when Dr. Stewart described for all of us what it means to sit on the other side of two chairs. and how over the years, the people who have filled those two chairs have shifted and changed, and sometimes they're more conventional, like we imagine them to be, and sometimes they're more evolving and human and different from what we ever imagined. And for all of us who are imparted with the honor of helping support these individuals become a family, always remembering that those folks come in all shapes, sizes, motivations, challenging paths, circuitous routes to building a family, and they are all deserving of that opportunity and of our compassion and understanding. So listeners, thank you for joining me today. I hope this conversation was enlightening. I hope it challenges you to having the perseverance that you need to set forth on your family building journey. It is well worth it. Until next time, take care.
At ConceiveAbilities, we believe that everyone who wants to become a parent can. Our agency has helped build thousands of families for nearly 25 years. Whether you are an intended parent ready to fulfill your family destiny, a surrogate answering your calling, or an egg donor wanting to expand what's possible in your life, we are your people. See how matching matters. Learn more by joining our Surrogacy Learning Center community at surrogacylearningcenter.conceivabilities.com.